Next, I would like to introduce to you the next K innovative company. They are going to introduce real-time total remote pathology platform technology for cancer surgery. Please welcome VPIX Medical. Hello, I am Hwang Kyung-min from VPIX Medical, which is developing C-cell. Recently, I read a very shocking article. The recurrence rate of cancer for patients having gone surgery is 20 to 30%. So this means that there are cancer cells that remain within the body of the patient. So if you have to go through a cancer surgery, not once, but twice or three times, then it will be a great suffering for the patients and the family. VPIX Medical is a healthcare startup marking our fifth anniversary this year. We want to become a company that proposes a real-time total remote pathology platform that helps cancer surgery. So our solution starts from C-cell. So C-cell is a handheld ultra-small fluorescent tissue microscope that enables digital biopsy. It has the main body and PIC section that directly contacts the patient's tissue. So usually the surgeon should remove all cancer tissues, and he removes the normal part that is large enough, including the cancer tissue, to check whether there is a cancer tissue at the boundary of the resected tissue. However, the remaining cancer tissue may not be visible to a naked eye. So the surgeon can actually look for lesions in real time using the PIC section in the OR. And fluorescent dyes are actually injected to stain the tissue, and laser is shot to activate the cells non-invasively. And when contacting the PIC section, you can see into about 1 micron of the interior. So you can actually use a PIC section to acquire unlimited number of cell images of the tissue. The captured images are sent right away to the pathology department to request a diagnosis of cancer cells. And this is the surgical remote pathology diagnosis platform that VPIX Medical has dreamt of and developed. So over the past 100 years before C-cell was developed, this process was done in a method called frozen biopsy. Frozen biopsy involves directly sending the removed tissue to the pathology department and requesting diagnosis, but this requires a lot of money and manpower. It's time-consuming, and pathologist department's work is overloaded, and surgeons have to wait 30 minutes to get their results. So this means that the surgery time increases, anesthesia time increases for patients. So if that is the case for hospitals, the OR turnover decreases, thus impacting the revenue. And this is not even possible in hospitals that do not have any pathology departments. To address this problem, over the past 5 years, we at VPIX have focused on creating a very small microscope that acquires 400 times more high-definition digital images in real time without having to slide the tissue. So here, 500 times higher means we can discern something that is 50 times less thicker than a hair. As a result, we succeeded in downsizing a large laser microscope small enough to be held by a hand. And this source technology has been patented not only in Korea but also overseas. And in order for we have two product pipelines. So in the in vitro diagnostics device, E-cell ex vivo. So the tissue excised during surgery, stained in less than 3 minutes by applying a fluorescent dye, and the image is acquired by contacting the probe. And the second is C-cell in vivo. So during surgery, a safe dye is injected into the patient, and the surgeon actually touches the tissue to acquire the image. So since we're injecting a dye, so we can actually check it in a real time. So in order for this product to be used for cancer surgery, image acquisition speed should be faster and resolution better. And a lot of the competitors actually fail to meet both of these requirements, but VPIX C-cell comes in a very small size, and we can actually acquire a high definition image of fast. So this is not limited to certain carcinomas like competitors, but it can be used for many cancer surgeries like brain tumor, lung cancer, and stomach cancer. And VPIX Medical has confirmed our clinical potential for pathological diagnosis with the new images acquired by C-cell during the past 1 year. We use C-cell to take images of lung cancer in normal lung tissue, and then after 20 and 30 minutes training, we show them to the pathologist randomly to make diagnosis of 30 cases, and the result was accuracy of 92%. And we will conduct further studies, and next year we will publish the paper in international journal. So for the past 5 years, VPIX Medical has achieved a remarkable growth. In 2018, we were listed on Slush 100. In 2019, we won the Challenge K Startup as a runner-up. We also won the Grand Prize at Women's Startup competition, and we were also among the top 3 companies by the Ministry of SME and Startups. And we raised 7.2 billion won investment, and recently we became one of the top 20 Asian companies at MedTech Asia Forum organized by Johnson & Johnson Innovator, and therefore we have indeed set the stage to go global. So we would like to combine VPIX's first product, C-cell, with a PACS system that facilitates remote communication with pathologists who are outside the OR. So we plan to become an all-in-one platform for emergency pathology diagnosis if we add an AI-powered solution. So we have spent this year to confirm the safety of our product, and based on the result of our safety test, we will also get an in vivo approval next year. And we will expand our use case to minimal invasive surgeries such as robotic surgeries and screening core biopsy sample. And also combined with AI technology, it will evolve into a more powerful digital biopsy platform. And if C-cell remote is applied to hospitals, pathologists can increase work efficiency, and surgeons can perform surgery more accurately and safely. So hospitals, more patients will undergo cancer surgery much earlier, so we can save more patients. So we believe that the C-cell is a company that can have a huge impact on patients and save their lives. So we will work hard to make sure that this technology will save the lives of our patients and their families. That's why we're betting our youth and passion on it. Thank you. Yes. So microscope that is even smaller than a finger, that is quite surprising. And what's more surprising is that tissue diagnosis can be checked in real time in OR. So I think that it can really change the paradigm of biopsy that lasted for the past 100 years. So I believe that K-innovative companies in the medical sector will indeed take off to launch to go